This topical kit is used to relieve itching and pain from skin conditions like scrapes, minor burns, eczema, and insect bites. It can also treat discomfort and itching caused by hemorrhoids and other problems in the genital/anal area. In addition, it can be used to decrease discomfort or pain during medical procedures/exams such as sigmoidoscopy and cystoscopy. The active ingredient, lidocaine, works by causing temporary numbness in the skin and mucous membranes. For best results, apply the medication as directed by your healthcare professional and follow the recommended daily dosage. It is important to use this medication at the optimal timing for maximum relief. If you are using the over-the-counter product to self-treat, make sure to read and follow all the directions on the product package before using this medication. If you have any questions, it's best to consult your pharmacist for guidance. If your doctor has prescribed this medication, be sure to use it exactly as directed. Before applying to the skin, be sure to clean and dry the affected area as directed. Apply a thin layer of medication to the affected area of the skin, usually 2 to 3 times a day or as directed. If you are using the spray, make sure to shake the canister well before using. While holding the canister 3 to 5 inches from the affected area, spray until the area is wet. If the affected area is on the face, spray the medication onto your hand and apply to the face. Do not spray near your eyes, nose, or mouth. If you are using the foam, shake the canister well before using. Spray the foam onto your hand and apply to the affected area. It's important not to use on large areas of the body. Cover the area with waterproof bandages or plastic, or apply heat unless directed to do so by your doctor, as this may increase the risk of serious side effects. After use, be sure to wash your hands immediately unless you are treating an area on the hands. Avoid getting the product in your eyes, nose, or ears. If the medication gets in these areas, rinse the area immediately with clean water. The dosage of this medication is based on your medical condition and response to treatment. It's important not to use more of this product, use it more often, or keep using it longer than directed. If there is an infection or sore in the area to be treated, it's crucial to consult your doctor before using this medication. If your condition lasts or gets worse, or if you think you may have a serious medical problem, it's important to seek medical help right away. After applying Ziloval 5% topical kit local anesthetics, you may experience temporary redness, stinging, and a slight swelling at the application site. If these effects persist or worsen, it's important to contact your doctor immediately. Your doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks. Most people using this medication do not experience serious side effects. Seek medical help right away if you experience any severe side effects, such as slow or shallow breathing, seizures, pale or bluish skin, unusual tiredness, shortness of breath, or a fast, slow, or irregular heartbeat. Although rare, a very serious allergic reaction to this drug can occur. Get medical help immediately if you notice symptoms such as a new or worsening rash, itching, swelling, severe dizziness, or difficulty breathing. This is not a complete list of possible side effects. If you notice any other effects that are not listed here, it's important to contact your doctor or pharmacist. Remember to consult your doctor for medical advice about any potential side effects. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088, and in Canada, you can report them to Health Canada at 1-866-234-2345. Before using Ziloval 5% topical kit local anesthetics, it's important to talk to your doctor or pharmacist about any allergies you may have to lidocaine or other similar medications. Let them know about any medical history, such as broken skin or infections in the area where the medication will be applied, heart disease, liver disease, or methemoglobinemia. If you are going to have an MRI test, it's important to let the testing personnel know that you are using this product, as some brands may contain metals that can cause burns during an MRI. Before any surgery, make sure to inform your doctor or dentist about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. It's worth noting that children may be more sensitive to the side effects of this drug, so caution should be taken when administering it to them. If you are pregnant, this medication should only be used when clearly needed, so it's important to discuss the risks and benefits with your doctor. This medication can pass into breast milk, but it's unlikely to harm a nursing infant. Be sure to consult your doctor before breastfeeding while using this medication. It's important to be aware of potential drug interactions when using Ziloval 5% topical kit local anesthetics. This includes both prescription and non-prescription drugs, as well as herbal products. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. It's crucial to follow your doctor's guidance and not start, stop, or change the dosage of any medicines without their approval. This will help ensure the effectiveness and safety of your treatment. Always consult with your healthcare provider for personalized recommendations. If this medication is inhaled or swallowed, it can be harmful. If an overdose occurs and there are serious symptoms such as passing out or difficulty breathing, it is important to call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., residents can call their local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of overdose may include drowsiness, irregular heartbeat, and seizures. It is important to seek medical help immediately if an overdose is suspected. Make sure to keep up with your regular medical appointments and lab visits when using Ziloval 5% topical kit local anesthetics. This will help ensure that you are monitoring your health and the effectiveness of the medication. If you are using this product regularly and happen to miss a dose, simply use it as soon as you remember. However, if it's almost time for your next dose, just skip the missed dose and continue with your regular schedule. It's important not to double the dose to make up for the missed one. When storing Ziloval 5% topical kit local anesthetics, make sure to keep it at room temperature and away from freezing. Keep it out of reach of children and pets. Do not store the gel or foam or spray canisters near high heat or open flame as they are under pressure. Do not puncture or burn the container. When it is expired or no longer needed, properly discard the product by consulting your pharmacist or local waste disposal company. Avoid flushing medications down the toilet or pouring them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.